Good day for all you parents and caregivers out there in the internet land. Welcome to this part of the Kids Go STEM discussion. Today, I want to talk to you a little bit about teen mental health and their resilience. We're going to kind of explore how the pandemic has impacted your teen's mental health and the strategies that you as a caregiver can have to help support them. My name is Michael Colburn. I'm a physician and adolescent medicine specialist here at the University of Iowa Stead Family Children's Hospital. I am the director of the UI Adolescent Clinic that is located at IRL. My partner today will introduce themselves now.
Yeah, hi, my name is Michael Edwards. I am a resident physician that specializes in pediatrics. That position gives me the opportunity to interact with and help middle school age children and adolescents on a daily basis. And I've been fortunate enough to pair with Dr. Colburn today, who is a specialist in adolescent medicine, to help you guys at home with your teens.
We have no disclosures or any financial relationships with anybody that we should talk about today.
So the goals of our talk today are going to be to focus on the signs and symptoms of mental health concerns in your adolescents and teens. And that's important because it can be more subtle than you think, and identifying these mental health concerns is the biggest barrier to treating them. And we're also going to focus a little bit on how this COVID pandemic has impacted mental health in the adolescent population.
We want you to be able to list strategies on how to manage depression and anxiety. It is good for you to have the key components in what we as physicians and people that are called therapists, as well as you and your teen, can all do to help begin to kind of combat depression and anxiety.
Then we're going to talk about developing some skills to communicate with your adolescent at home about their mental health in ways that can help identify these mental health concerns, as well as help them manage them.
And last, we want you to recognize that resilience is there and present in your teen, and how can we help nurture that resilience in times of stress, such as we're witnessing now in the COVID-19 pandemic.
I think it's humbling while we start this talk to reflect back on the long list of things that an adolescent has to do. As adults, we get in the hustle and bustle of our day and all the stresses that we have, and we forget about everything that's on the plate of a 12-year-old as they enter adolescence and work towards adulthood. The biggest task they have is developing their own identity, figuring out who they are themselves and how they can take care of themselves. As they move forward, they learn more about society's rules, and they can decide for themselves from an ethical standpoint how they feel about these rules, where they fit in, and really working towards what they think is right. Next, they have to learn about relationships with other people, including their parents, their siblings, their friends. And this involves dealing with people they don't like and how they have to practically deal with these people. Next, they have to learn about their own sexuality, which is a big task in and of itself. And then as they move forward, they're exploring what they want to do with their lives and how they can develop skills to pursue those goals. In all of this, they get the help from their parents. So they have to learn how to view their parents in a more realistic fashion. And when they develop their goals and who they want to be, they have to find someone that's going to embody their aspirations as they move forward towards their goals, whether that's their parents, their friends, or someone else in their life. And as you can see, that's a long list of very complex things that an adolescent has to deal with. And then we throw in this global pandemic. And as you can see, a lot of those skills and things we had talked about on the prior slide deal with interacting with people, which the COVID pandemic has limited, unfortunately, for adults and adolescents. There have been studies that have shown there's been a negative impact on adolescent mental health, and that meaning increased mood disturbances secondary to the social distancing, the interruption of their daily lives, not being able to go to school, and then this overall anxiety of what's going to happen next, and where do we go from here. And we unfortunately know that increased mood disturbances can lead adolescents to increased self-harm behaviors. So this is all very important to talk about and identify as a problem as we move forward into this pandemic.
So I think it's a little helpful for us to understand adolescent depression and what depression means and how prevalent it actually is. Prior to the pandemic, 1 in 8 adolescents in the United States would be classified as having a major depressive episode. Out of that greater than 12%, we would see that 70% or more would be severely impaired by this, showing signs that they were struggling with school, relationships at home and with friends, and self-esteem and how they viewed themselves. Out of the people that are experiencing depression, it's estimated that less than 60% or greater than 60%, I should say, have not received any form of treatment or engagement to help them be on a pathway to progression. So what does actually depression look like? And I know this slide is a little comical for the topic at hand, but I think it's a good way to kind of represent and start thinking on how we view these words and what these words might mean. So if you close your eyes and you would think about what depression means to you and what comes and pops in your head, are you seeing that person that is having their head hang down low, that is tearful, that is maybe even painted blue in a cartoon, that is locked away and listening to what? I don't know, Alanis Morissette? Is that what depression is? How many of you have experienced a teenager that's coming home, that's angry, that's looking for a fight, that slams the door, that always seems to be putting up a confrontation with you, with loved ones, and it's hard to talk to? Is it normal for teenagers to be angry? I would tell you, when most teenagers are depressed, they're going to be having signs of irritability and anger over signs that we view as sadness, which we mistaken for depression sometimes. So looking at kind of irritability and how a teen is reacting to their environment can clue us in onto their mood and also be a key sign for depression. Depression is not only how you're feeling, but it can impact your body and other things that go about your day. Teenagers with depression can have sleeping difficulty. It can be hard for them to fall asleep. They can be having thoughts and worries and things that kind of difficult to shut their mind down and be able to go to bed. On the flip side, they can have just sleep needs that are high, where they're tired, where they don't have energy, and they're sleeping all the time. They begin to not find things fun that they used to love doing. Now, our hobbies and our passions evolve with time, but they start finding things recently that they like that are more of a hassle, more of a chore, or they view that they might not be good at. A teenager that loves video games that all of a sudden no longer has the time or the motivation or the desire to play video games might clue you in that there's something else going on. They can have negative thought worth where they're not good enough or they're a burden to people. They can feel hopeless. Like I said, with sleep can come energy. They can have difficulty concentrating at school. Their appetite can go up, their appetite can go down. They can seem slow or they can seem jerky and irritable. And they can even have thoughts of escape. These thoughts of escape we call suicidality, where they can be wishing that they weren't around. And those can sometimes shift to thoughts about wishing that they were dead.
Another very prevalent mental health concern in adolescence is anxiety. Now, you and I, we all have anxieties about everyday life, but what we're talking about here is anxiety disorder. Disorder meaning that this anxiety impairs one's ability to accomplish tasks on a day-to-day basis and is very hard to control. The lifetime prevalence of an anxiety disorder in an adolescent is pretty high. It's 1 in 4, so 25% of adolescents between the ages of 13 to 18 will struggle with an anxiety disorder. And the more shocking statistic for this, kind of along with depression, is only 18% of those kids will actually seek treatment and receive treatment. So again, going back to identifying anxiety disorders is kind of the biggest task that we have to tackle right now. When we talk about anxiety, it's important to recognize that there are multiple different types of anxieties. The biggest one is general anxiety disorder, and this is worrying about most things most of the time on a day-to-day basis. And this anxiety, like I said, is very hard to control with normal, just relaxation techniques that we use to not worry about something that we're going to have to do tomorrow. Another type of anxiety is separation anxiety. This is when kids are afraid to leave home. They're afraid to not be around someone, a loved one, a friend, and this can be crippling for them in that they're not able to do things outside of the company of that specific person. Juxtapose that to social anxiety, and that is kids that are afraid to leave the home. They're afraid to go to school. They're afraid of public embarrassment. And again, you can see that can be very crippling for kids that are struggling with that. The next thing would be a panic disorder. And this is when anxiety gets to the point where we're actually having physical symptoms from the worry that we can't control. This can include a lot of things. Common ones would be headaches, lightheadedness, and an upset stomach. But it can range anywhere from shortness of breath, pain in our chest, breathing very quickly, or having this sense that something really bad is going to happen to them. And then lastly is phobias. And this is a very specific type of anxiety. I think we've all heard of someone or know someone who has a phobia, whether it be flying or heights or spiders. But again, this can be something that can be very detrimental to someone's ability to accomplish things on a day-to-day basis. So one thing that we want to help you guys with this presentation is to recognize some of the subtle signs of anxiety. If kids are having recurring fears about everything in their day-to-day routine, this might not be as subtle, but something that can clue you in that they might be struggling. The physical complaints, like we had talked on the prior slide, of headaches, stomach aches, lightheadedness, all can be clues to, especially if these symptoms are related to certain aspects of the day, like going to school, they all of a sudden get a stomach ache. Kids can have a big problem with concentration when they're very anxious. This might reflect as poor school performance, specifically, or having difficulty succeeding in their extracurricular activities. Sleep, like depression, is another thing that can be greatly impacted. We believe that kids have more difficulty with sleep with anxiety because as they lay down to go to bed, the distractions of day-to-day life are no longer distracting them from the fears that they have. And so they may sit there and worry about everything that they would typically worry about. And so we'll kind of talk about some management strategies, but finding healthy concentration or healthy distractions can be helpful for that. But other signs: avoiding social situations. Again, the kid that doesn't want to go to school or go to a friend's house. Avoiding leaving home can be another one. So kind of similar to the avoiding social situations. And then fear of not being around a loved one, as we had said, like a separation anxiety. So they always need to be right on your side or right on their sibling's side, and not willing to go and be separated from that specific person can be another symptom.
So now that you have some of the tools to be able to identify if there are things that are preventing your teen from being the healthiest and most successful teen they can be, it probably would be good for us to give you some ways on how you can help your teen. How can you combat these risk factors where they're being exposed to bullying on social media, the restrictions that we've put in place regarding the COVID pandemic, and even things that we might view like peer pressure. So this is when we like to talk a little bit about resilience. Resilience is already present in your teen. You do not need to create resilience for them, but as a parent, it is important for us to nurture it. When anybody, I would say, gets stressed, their first impulse is to relieve that discomfort. We want that stress to go away, and we're going to do something that a lot of times is the easiest thing for us to do to make that stress go away. However, they might not have the best tools yet for us to make these healthy choices regarding our stress. As parents, it's good for us to provide guidance on positive ways to relieve stress. What's working for you? What are healthy ways that you relieve stress? And we're going to talk about some of those. And it's good for us to discuss kind of like how we can help foster this environment where they can ask for help and not just talk about the consequences around the unhealthy coping mechanisms. When teens know that substance use is bad, but we don't give them ways to get out of using substances, it's not going to be the best way for them to have the tools to get out of these stressful situations.
So another way to approach these mental health concerns is having a very healthy mind-body connection. And there's very strong evidence that having a healthy body does promote a healthy mind. We wouldn't be doctors if we didn't tell everyone to go outside and exercise. So we're definitely going to talk about that today. And this doesn't have to be anything crazy. You don't need to train to run a marathon. Just going for a simple walk outside around your neighborhood can be so great for your body and your mind. Other things, like in the winter time here, if it's poor weather, especially in Iowa, we can do things inside. So this could be simple things like putting on music and cleaning around the house, walking up and down the stairs a bunch of times. Really anything that gets you up off the couch, moving around, getting some blood flowing will be great for your mind and your body. Other things, especially during the pandemic, people have started taking up new hobbies. I think everyone I know on social media learned how to cook something new over the past year. So if cooking something that you find interesting, you certainly can try that. Art can be another thing to kind of endeavor into. Anything that can get your mind kind of mentally engaged in something other than the mental health concerns that you have will be beneficial. Um, Staying socially connected, like I said, is a big thing that's beneficial to our mental health, especially in the setting of this pandemic. Whether that's staying connected with your family by doing family movie nights, having a family game night, those can be great, just gathering times for the family to kind of unwind and think about something else, or staying virtually connected with your friends, doing Zoom meetings, um, playing video games online with your friends, I think can be great too, just to interact with someone outside of your household in this pandemic. And then we always hit on sleep. Sleep is incredibly important for our brain, for our development, for our mental health. Kids in this adolescent age group should be getting 8 to 10 hours of sleep. I know that can be challenging. Like I'd said, with anxiety problems, finding things that are healthy distractions at nighttime before bed would be like reading a book. Playing those board games are great too. Anything that's not staring directly at your phone to promote healthy sleep. Even watching the TV from across the room can be helpful too, just to unwind right before bedtime. But we know that getting that 8 to 10 hours of sleep, like I said, is great for your mental health, and kids actually do better in school too when they get that full amount of sleep.
So we have some tools, and it's very good for us to look at these ways and how do we create and foster a way as a parent or caregiver to kind of create these healthier options and doing things as a family, walks as a family, games as a family. Those are all going to help our social connections. When we partner with our teens, there are things that sometimes we feel are very helpful things for them, but actually might be causing more harm than good. So it's good for us to have a perception of how your teen is feeling and what kind of things to do. Sometimes we think maybe not talking about a problem can make the problem go away. But creating these environments of silence and secrecy around mental health is not going to help your child realize that there are other people that have been experiencing depression and anxiety, and it's not their personality trait, but it's something that we can help them grow from, right? Share your own feelings and your own experience with anxiety, depression can help decrease that mental health stigma. It can help them not feel alone. And together, then that helps them learn ways that they can deal with these stressors. As parents, sometimes it's hard for us to kind of realize, experience the signs of mental health. We might ignore things. We might think things are just normal teenage behavior, but it's important for us to kind of recognize these signs and figure out how we partner with our teen. How do we partner with our teen's doctor to help them be healthy? I never want you to ever shrug off a threat about suicide just as typical teen melodrama. These are ways that your teen is reaching out to you to talk to you about their dissatisfaction and how things are going regarding their mental health. So please take those conversations seriously and partner with them to help them be healthy. Blaming the teen for their current mental health, and that sounds bad, right? But we think of things like, if you would just do this, if you would just do your homework, then school wouldn't be so bad, you wouldn't be so far behind. If you would just get out of bed, right? So figuring out how we can advocate for healthy decisions without putting it as solely their fault. Their depression is more than just the fact that they didn't get that homework assignment done. Blocking access to social supports and resources can be detrimental, especially when people identify different than they view at the home or rural Iowa. It is good for people to have connections with people they can relate to and see their identity. As Dr. Edwards was talking, it's in the beginning, it's important for them to have these role models or see themselves in the community and in society so they can begin to grow into these roles that they are. It's good for us never to be punitive, regarding a teen's orientation or their gender expression. It's going to undermine their self-esteem and self-worth. And enforcing gender conformity will never result in actual gender conformity. It's just as detrimental for teens' mental health.
So some things that we can focus on at home when it comes to communicating with our children about their mental health concerns. Number one is just listen to them. Listen to what they're going through. Listen to what's bothering them. Listen to their side of whatever they're dealing with. And then validating their emotions. Instead of focusing on their unhealthy behaviors, just say, I think you being worried about that sounds very appropriate, or you feeling sad about this is totally understandable. And as a parent, this is difficult, but trying not to go into fix it mode. Just listen, validate their emotions, and then we can focus on fixing things later. When it comes to some of the ways that we can work towards better mental health at home is get your teenager or adolescent involved in a community activity or something that will keep them activated and socially engaged. The socially isolating behaviors will come. They're going to be on social media every now and then. They're going to be in their room listening to music, but getting them involved in something during the day that gets them out interacting with other people is going to be great for them. And then, as Dr. Colburn was saying, not placing the blame on the teen themselves, accentuating the positive things that they're doing. Like if they went to school, say, I'm really glad you got out and went to school today, and not focusing on some of the negative things, like maybe they didn't get all of their homework assignments done. And then, of course, we want to refrain from stating anything that you're disappointed in, kind of like Dr. Colburn was referring to as well. Like if you would just get out of bed, then you would be able to do better in school, kind of avoiding things that focus on the negatives. And then helping them get treatment. I think a great way to start is just asking them what they think would be helpful. As physicians, we do that as well. Just kind of get in the mind frame of what do they think might be helpful. As parents, always remaining supportive, always helping them stay engaged, talk to people is going to be great for every kid. And then as a parent, once you reach that point where you think you can't help anymore, the pediatrician's always there for you guys, and knowing that we have resources that we can help you guys get connected with that can help your teen who might be having difficulties with these depression or anxiety problems.
I love Dr. Edwards' slide right here and the bullets that he's put together to kind of help look at ways that we can explore this. I think as parents and caregivers, it can be very hard for us not to want to fix what is wrong, right? We all want what's best for our kids, but sometimes we might not just have those tools to be able to help. So being that supportive listener and helping validate their emotions, like Dr. Edwards was saying, without validating unhealthy behaviors. It's good for them to be able to express who they are, express how they're feeling, and we want to make sure that we're providing support in that place and helping them learn about better health and coping mechanisms so that they can continue to progress into the awesome adults. And we as providers and pediatricians and people who work with mental health are always going to be available for you to help you continue to partner with your child during this time so that you have even better tools to help them in certain situations where their frustrations, their mood can sometimes be fairly significant and even stressful for you, right? So let us know how we can help you. So once again, a strong slide. When we're really starting to open up and have conversations with our teenagers are going to view us as a person that they can talk to and a person that they can ask help for. And when that happens and we have these open lines of communication, teenagers can sometimes talk to us about their safety, about thoughts about not wanting to be around, about thoughts about suicide. Suicidality, when we think about it in the media and TV and stuff, it's always an outcome is what we're hearing about. But actual thoughts of suicide can be a spectrum where people can have thoughts of escape, where they're just like, I wish I didn't have to do this. It's hard to just keep going. I wish I could stay in bed. Those thoughts could then shift to thoughts about how if I wasn't around anymore, if I wasn't alive, I wouldn't have to deal with this. They can have thoughts about how they might end their life and they can then actually go about ending their life. And they might stop themselves. They might have someone that loves them stop them, or they might not stop at all. So it's great to be able to have these open lines of communication with your child, that they can have these conversations with you. Sometimes when we're worried about our kid, we might be asking them, hey, how's things going? Do you feel fine? Is everything good? And they might not feel fine. They might be feeling bad about not feeling fine. So sometimes having language about assessing safety by asking questions if they feel safe is a good way to do that. And then your team can say, yes, I feel safe. They might not feel fine, but they're working on that, but they feel safe. And that's good. We've created an environment that keeps them safe. When a teenager says that they don't feel safe, then our goal is to provide distraction, right? In that headspace they're at right now, let's get them out of there. As a parent, do stuff, games, high V, be distracting, make a joke, spend time with them, keep them safe, be a good distraction. That helps your teen be able to kind of have those thoughts subside and keeps them safe. At any time as a parent, you're worried about your child's safety, partner with us, providers, physicians, the emergency room doctors. We will be there for you to help you keep your teen safe. It is good when we're worried about safety to look at ways that we can create a safe environment. Suicidal actions for teenagers can sometimes be highly impulsive, meaning they might not think before they act, which, if you think about your teen, can happen for other things as well, right? Ways to create a safe environment for teens that are depressed is look around. Are there firearms in the home? I'm not here to tell you to get rid of your firearms, but right now with your teen, it might be good to have guns, visit grandma and grandpa for a while. Make it one step harder for them to get access to it. Look at your medications. Are there ways that we can have our medications in a safer place that the teen can't impulsively get into it and cause harm to themselves? So looking at ways for us as parents to create barriers to keep our children safer is always a healthy thing to do when we're working with a depressed teen. When you are like, I think my teen would benefit from partnering with a provider, a mental health provider, a pediatrician, it's nice to kind of understand how that first visit's going. The fear of the unknown can really impair people from seeking care. So as a parent and a caregiver, I kind of want you to know what to expect during that first visit. The first goal is to recognize and understand if there is a mood or anxiety disorder, such as depression or a type of anxiety. That's usually done through screening questionnaires that the teen is provided, and it's important for us to hear their words. So allow your teen to fill out those questionnaires. It's important for us to see the family perspective. What are you seeing as a parent? What are you noticing? What does the teen talk to you about? But it is also important that we give the teen a confidential time that they are able to talk to their provider. Our goal is never to have secret conversations, but our goal is to be able to create a safe space so that the teen can tell anything to us uninhibited so that we're able to help them the best. Our goal as doctors is always to partner with that teen to figure out ways that they can begin to feel more comfortable bringing up these issues with you as their parent. If any safety concerns are brought up during that confidential interview, you are always brought into that conversation as an advocate and someone to help keep your teen safe. The second goal is to provide education. We want to understand the disorders such as depression, and we want to know what the treatment options are. And these conversations should be directed towards your teen because it's important that your teen understands depression and understands the treatment options. It should be inform them of regarding the typical symptoms, how their fatigue, their low energy, their concentration relates to their mood disorder, and what's the typical course. Depression is an illness and a disorder, right? It's not a sign of a weakness. It's not someone's fault. It's not a personality trait, and it doesn't need an external trigger. It's important for us by talking about treatment to restore hope, allowing them to know regarding family interventions, therapy, and medication. And the third goal is to have close follow-up, which has been shown to be very beneficial for progression. So that there is a little bit of a talk on how the pandemic has altered your teen's mental health, ways to recognize if there is a disorder to their mental health, strategies at home to help improve the whole family's mental health as a unit, and what to do when you have concerns and how to partner with caregivers such as us. We are available for you here at the University of Iowa Stead Family Children's Hospital. We are happy to talk to you about any concerns and provide care across the board for you and your teen. So let us know how we can help. Dr. Edwards and I wanted to include some web resources that are very good at how to kind of help partner as a parent regarding your teen's mental health. The American Academy of Pediatrics has a great website called healthychildren.org and has very good resources regarding strategies for you and your family to engage, as we talked similarly on this talk today, to help you be a mentally healthy family. The Young Men's Health site and the youngwomenshealth.org are both great sites by Boston Children, and they're geared towards teenagers and young adults. So when teenagers have questions about their body and their mental health, this is a good place for them to get solid information written for them by young adolescents and doctors that are geared at caring for them. Sometimes Googling gets you strange answers, so it's good to have good resources at play. And once again, uichildrens.org is always a good resource and a good place for you to seek the care that you need. With that being said, I think that concludes our time with you today. And we, both me and Dr. Edwards, thank you for listening.